Hi everyone, this is Dr. Kalpana and you are watching this video on my YouTube channel Pharmacy Lessons Made Easy. The topic for today's presentation is e-prescription or electronic prescription. Now, what is a prescription? Prescription is usually written order by a registered medical practitioner, the other name is RMP, to a pharmacist, giving silent instruction for dispensing of a prescribed medicine. Or we can also say that it is a mean of providing treatment to a particular patient in a very systematic manner with the combined counseling and services of both physician and pharmacist. The prescription provide a common link of natural interest between the physician, the pharmacist and the patient. It is the primary duty of physician to serve the medication needs of a patient whose intention is to heal the patient. The pharmacist should not only compound the medicine but also should instruct the patient about the proper and safe use of it. Pharmacist should maintain the decorum and propriety of profession by maintaining confidence regarding the treatment intended by the prescriber. Now, in older days, the prescription were generally written in Latin language and using some Latin abbreviations. Due to this, till date, some Latin words are still in use to keep the prescription secret from the patients. Although Latin words are in use, yet the language used in prescription writing is English. But the current scenario is electronic prescription, and which may dominate via internet, by which pharmacists may receive the prescription. So let's begin today's topic. It is based on electronic prescription, also called as e-prescription. So we should understand what are the advantages which are associated with electronic prescription. I shall name a few of them. Like, it will reduce the errors with handwriting problems. Generally, the doctors who write that prescription are not having very much clear handwriting. So by electronic prescription, these handwriting related issues can be sorted out. Another one is the patient prescription can be retained easily. So for medication history, electronic prescription may prove very much beneficial, which is not at all possible with the case of normal prescription. Refill request can also be expedited because you are having the record already inside the computer. Moreover, the computer allows data exchange between the physician and the pharmacist, which will allow an individual to better manage the time and facilitate interaction with their patients. I would also like to mention that in electronic prescription, before prescribing, the doctor can receive on-screen prompts for drug-specific information. Now, how you define electronic prescription exactly? How it is different from the normal prescription? The electronic prescription is an accurate, error-free and understandable prescription which is electronically sent by physician via the internet or any other telecommunication channel directly to the pharmacy chosen by the patient. Moving further, what is the need for electronic prescription? First is eligibility in prescription. That means almost 40% of the prescription require a clarifying phone or direct conversation between a pharmacist and a doctor. This I am talking about the normal prescription. Thus, the electronic prescription is an effort to overcome such kind of clarifying conversations, because as I already mentioned, there is a direct contact between the prescriber and the pharmacist, so they can directly interact. There would be lesser chances of clarifying calls or clarifying communication between them. Moreover, in the year 2000, Institute of Medicine identified medication errors as the most common type of medical errors, which are dangerous because we are dealing with the welfare of mankind. So, the chances of error should be minimum. Otherwise, that may lead to fatal results. Moving forward, what is the scene after using the electronic prescription? I have collected a few facts which will demonstrate that what are the effects of using electronic prescription. The use of electronic prescription have cut the transaction errors by 84%. See, this is a drastic change. It has saved more than $4 million in adverse drug reactions during the year 2009. Over 370,000 prescriptions changed or cancelled due to drug interaction warnings. Also, the number of prescribers routing prescription electronically grew from 74,000 at the end of 2008 to 1,56,000 by the end of 2009. This include 26% of all the office-based physicians, 23% of all office-based nurse practitioners, and 20% of all office-based physicians assistants, right? So this is all about what are the effects. So the current slide is indicating that how we have overcome the errors by almost 84%. Moving forward, this slide is a description or the demonstration of what are the different channels or what are the different agencies which are directly or indirectly involved in electronic prescription. So SureScripts, RX Hub, ENHEC, ANSI, NCDPP are few examples of this. So these includes all like stakeholders, certified application technology vendors, secured national networks, accreditation and certification organizations, standard organizations, and industry leaders. Now this slide is highlighting the early years of healthcare IT. That means how the healthcare IT has progressed it from late 1970s. The journey started where the pharmacy started installing computer system and submitting computer generated claims to insurance companies. In the 7 years almost, in the year 1977, NCPDP was formed to standardize insurance forms. Universal Claim Form, which is also abbreviated as UCF, adopted it in 1978. After a few years of approximately 10-year gap, in 1987, PCS introduced electronic claims, which are other pharmacy benefit managements followed them. And in the next year, 1988, NCPDP developed telecom standards V1.0 and pharmacy software vendors and the chains coded for electronic claims. In the year 1997, NCPDP developed script standard V1.0. See, this NCPDP is the National Council for Prescription Drug Program. It is an ANSI accredited standard development organization which represents all facets of pharmacy. This is how the healthcare IT industry has progressed, and we have utilized it in electronic prescription. That's why I have mentioned how it progressed with due course of time. Further, if we move forward, the timeline of key electronic prescription events are like in the year 2001, RX Hub and SureScripts both were founded. In the year 2002-03, RX Hub and SureScript began network operations. In December 2003, Medicare Prescription Drug and Improvement Medication Acts were established. In the year 2005, the establishment of foundation standards was done. In the next year, July 2006, IOM report was released, which was based on preventing medication errors. Then in the year, and then very next year 2007 April, CMS proposes 3 new electronic prescribing standards which were effective from 1st January 2009. And in the same year, in August, electronic prescribing becomes legal in all 50 states. In the next year, June-July 2008, DEA issues proposed rule to allow electronic prescription for controlled substances, and this commenced due 9/25/08. Congress passes Medicare bill with electronic prescribing initiative, which was abbreviated as MIPPA. Then in the same year, RX Hub and SureScripts merged together. In the October month of 2008, CMS holds seminal electronic prescribing conference which extends FEX exemption until 1/1, that is 1st January 2012. It issued regulation on electronic prescribing initiatives for Medicare Part D. Now moving forward to our next slide, which is indicating how this electronic prescribing or e-prescribing works. So the first step is from the patient to the certified clinician application, where it collects from the patient the information like the consent from the patient, his or her name, his or her date of birth, the gender and the zip. The second step is moving forward of this certified clinical application to the SureScript or RX hubs, which are basically the electronic prescribing agencies. The patient uniquely identified in MPI and request for patient information is sent to payer and pharmacy. The third step is the certified payer and the certified pharmacy will work here in the step 3, where it provides the patient eligibility, benefit and formulary, medication claim history, etc. Whereas certified pharmacy processes the medication pharmacy history. The next step is the validation step, where validation is done, validation of the information which is received with the patient. Thereafter reviews benefits and select therapy is done. Then pharmacy selected by the patient is chosen, and after this electronic prescription is generated. The next step is the transfer of this certified clinical application generated electronic prescription to the certified pharmacy. Now what are the benefits which are associated with electronic prescription? It will lead to more complete medication history, because every time the patient history and all will be displayed with the pharmacist as well as the prescriber or the doctor. It will display the economic alternative also. There is no illegible handwriting, which was a problem earlier with the normal prescription. It has been reduced because everything is typed. There is no chances of handwriting error. It will reduce the pharmacy callbacks because there is a proper communication between the pharmacist and the prescriber. And ultimately it will lead to more convenience for the patients. So there is in the sixth step, it is establishing an equilibrium or a communication between the certified pharmacy and the certified clinical application, because they are in contact with each other through electronic means. So this is how an electronic prescription looks like. It is giving the information like sign, save and order, print and save, assign, cancel. These are all the options which are available for the prescription to be edited and prescribed thereof. The information that is with the electronic prescription are: one thing, the name of the store, the physician's record, I mean what is the name of the prescriber, who is prescribing, physician's detail, the detail about that patient, what type of drug he or she has recommended, what are the warnings, the RX symbol, the Jupiter symbol for the god of healing, to pray for the patient to heal in a better way, the name of the medication, its brand name as well as the inside medication, right, the journal name, branded name, how much is the quantity of that medication. how much the prescription, like how many times it is to be taken, how many refills, when to start with, what are the directions of for the use, how to take it, and any of the drug interaction, how will be the onset, severity of that medication, what could be the possible effects, what could be the mechanism of that particular dosage form or that interaction, and how to manage that drug interaction. So all this information is contained inside a single window. So this is how that electronic prescription will look like in journal. It may vary with different software systems, but it is a basic information that an electronic prescription contains. This is another example how it will look like. Now moving forward with what are the scopes of electronic prescription in future. It will reduce the adverse drug events. How? Because there are minimized chances of errors. So those adverse drug events which may result due to the improper prescription, that can be avoided. Moreover, the drug interactions have already been highlighted, so the patient can avoid such type of interactions. Moreover, that calling back and the communication error between the prescriber and the pharmacist, that can be overcome. So a few reasons are there, that's why there are the chances of reduced adverse drug events with the electronic prescription as compared to the normal prescription. Moving forward to the second point, it reflects that there might be decrease in amount of inappropriate medication therapy. Right, with the help of electronic prescription, there is clarity in the mind of everyone, with the patient, with the prescriber, and with the pharmacist. So the inappropriate medication therapy can be avoided. Next thing is, it improves the patient compliance in a way like it will increase the first fill percentage, it increase the persistence through availability of medication history, and prescribing of affordable on formulary medications, because you have the chance of seeing economical value of the drug also. So all these three factors will lead to improvement by the patient compliance. Next is increases prescription of generic and low cost alternative medications. These days on the normal prescription, the prescriber writes only the name of generic product, not exactly generic product but the brand name of that product. So with the patient, there are less chances of selecting the generic product out of it. So if both the names have been displayed on the electronic prescription, the patient has a choice of selecting the generic or the lower cost alternative medication. So that will also ultimately lead to better patient compliance. Next is reduction in processing workload. Obviously, moving from one place to another, that will lead to transportation charges also, consultation charges also, right? And the calling communication, that will also get reduced. So overall, the processing workload will get decreased. The documentation and the retrieval, that will become comparatively easier because everything is on your desktop. So it's very much convenient for everyone in terms of documentation and the retrieval of data which have already been entered inside the computer system, and which is available for everyone to to explore and retrieve. So these are a few scopes of electronic prescription. Now the progress report of electronic prescription, starting from 0 in 2003 versus the estimate of full year 2008, is just a very brief data in the terms of member records, patient visits, electronic prescriber retail pharmacies, electronic prescriber mail order pharmacies, and electronic prescriptions. So here is like member records almost 66%, right? Patient visit 14%, electronic prescriber 15%, electronic prescriber retail pharmacies 79%, electronic prescribing mail order pharmacies 70%, 6 of the top 10. Electronic prescriptions 100 million, that is 6%. Moving forward to the next phase of electronic prescription, that is, what are the obstacles in electronic prescription. The obstacles might be, one is making physicians to order prescription electronically is a challenge. It is not at all being made systematic with every physician. They have to be trained, they have to be made familiar with the softwares and all that skills. So it's a bit challenging task to make every physician electronically available. Next thing is physicians which are not interested to invest money on computers for electronic prescription. That would be the second challenge. The third one is the expenses which are associated with buying the software. That is also a major challenge which is associated. Moreover, there is no direct benefit to the doctors. On doing that electronic prescription part, the doctors are not extra benefited. So that's why these four are the major hurdles or obstacles in the path of electronic prescription. Moreover, it takes more time than the paper prescription. The doctor have to worry about dealing with equipment failures or other transmission errors. So with everything, when you start at the first time, there is a bit hesitation also, and there is no direct evidence that this method will proceed further or that will be beneficial. Moreover, they are not getting economical benefits out of it. The next point is most pharmacies cannot possess electronic prescription. There are a few challenges like security of that prescription. Anybody if got the password and all are able to know the electronic history, which everyone don't want to disclose with everyone, right? So there are no fixed legal regulations for electronic prescription. So that is a major hurdle in the path of electronic prescription regulations. Now is what could be the possible solutions to the obstacles which might favor that challenging part. So the solutions, the most common solution that have been put forward are, first is free training course about electronic prescription. If that is available, the doctors, the pharmacist and the patient can be made trained about that electronic prescription concept. Or the free or subsidize the upfront cost, usually the drug companies or the hospital, because the doctors need not to buy that software. So the subsidy in that in the cost of that software and all, that could be provided. Moreover, the mutual agreement with the software companies, if that can be done, the economic part of the doctor which is offering the obstacle in the path of electronic prescription, that can be overcome. And the fourth part is incentives for physicians who are writing prescription electronic. If we provide extra benefit to them if they are writing the prescriptions electronically, so that providing of incentives can be a promotion factor for electronic prescriptions. Only new prescription takes more time. Paper prescription while refilling is much easier. A proper connection between pharmacy and clinical board. All pharmacies should be well equipped. Security of internet based communications. A proper and uniform legal regulation for electronic prescription. These are also a few solutions which could be put forward to overcome the obstacles. Now, what is the scenario in India? Apollo Pharmacies is one of them. It is the largest retail pharmacy chain in India with over 70 round-the-clock retail outlets in India. Apollo Pharmacy is moving towards offering electronic prescription-based services to the end user and the doctor. I hope you like this video. These are for more information you can refer to these sources which are mentioned on your screen. Thanks for your kind attention, and please like my video. If click on this like button if you like the video. Subscribe to my channel, that is Pharmacy Lessons Made Easy, and please share it on social media. Thank you very much.